The Future of AI in the Health Sciences Summit was jointly hosted by the Washington State Department of Health and the University of Washington's 6 health sciences schools.
The School of Public Health at the University of Washington has a really long-standing and deep connection with the Department of Health. And we have what's called an academic health department partnership with them that predated the pandemic. That played out really nicely during the pandemic in terms of the health and well-being of the surrounding populations, because there were deep relationships there.
I always say that we can't do our job in public health unless you have amazing partners. And our partners include UW, University of Washington School of Public Health, Dean Godwin. The entire faculty have been so instrumental during the pandemic and certainly well after the pandemic.
One of the things I really appreciate is that Dr. Shah has been deeply committed to strengthening those partnerships further and extending them to include the tech industry.
AI has the opportunity to really change the dynamics of public health, how, one, we interact with the public. So there's so many applications from a communication standpoint that allow public health professionals just to do a better job of communicating with the public. So there's that amazing component. It also has the opportunity to help our decision makers on the inside of an agency really understand the landscape of what's happening in communities in real time using predictive analytics and a deep back-end understanding and deep learning of the data that exists around public health. And when you think about a pandemic and the scarcity of resources and what we just went through with getting vaccinations and getting information to people, that's a real powerful tool.
This is our first convening co-hosted with University of Washington School of Public Health, and we're so super excited to bring people together. The reason this is important is we know that health and AI absolutely interconnect.
And what we have today is just a conversation between academic, private partners, and public partners coming together to really talk about all these issues and how do you meaningfully move it forward to impact the community, impact the health of others, and make our place a better place to live in Washington State.
It is a new age. It is an absolutely new age in health, digital health, health and technology, health and AI, AI together. All that means that we can do some amazing things. We can only do that if we start to have those conversations today for a better tomorrow.
The summit convened professionals across academia, public health practice, and the private sector. This included a keynote speaker.
To quote Ethan Mollick, who's one of my favorite writers and thinkers in this space, you haven't really experienced AI until you have had at least 3 sleepless nights of existential anxiety. So if I accomplish one thing throughout this talk, it'll be that you'll go home, you'll spend a lot of time with this, and you'll lose some sleep later this week.
And opportunities to engage and connect around several key themes, including practical applications of AI in public health, research around AI tools and frameworks to improve the health of the public, equity and ethical considerations of AI in the health sciences. If you'd like to view recordings of the keynote and panels, please join us at https://waportal.org/partners/health-innovation-partnership.